Have you ever walked into a room and suddenly forgotten why you went there? Or struggled to remember a name that you knew perfectly well just a few hours earlier? Many people over 60 experience moments like these. While occasional forgetfulness can be a normal part of aging, some seniors wonder whether certain everyday habits could be affecting their memory more than they realize. One topic that has received growing attention is medication use. Millions of older adults take medications every day, often for sleep, allergies, bladder problems, anxiety, or other common health concerns. These medications can be very helpful and important for many people, but some researchers have also studied whether certain medications may be associated with memory problems or an increased risk of cognitive decline in some older adults. Before we continue, it is important to understand something. Some studies suggest that certain medications may be associated with an increased risk of cognitive side effects or memory-related concerns in some people. However, this does not mean these medications directly cause dementia. Never stop taking a prescribed medication without first speaking with your doctor or healthcare provider. Before we begin, please like this video, subscribe to the channel, and tell me in the comments, what is one thing you do every day to help keep your mind active? Medication number 1, diphenhydramine. Now let's start with the first medication on our list. Diphenhydramine is commonly found in allergy medications such as Benadryl, and in some over-the-counter sleep aids. Because it is easy to buy and widely available, many seniors use it without thinking much about it. The reason researchers have paid attention to this medication is because it belongs to a group of drugs known as anticholinergics. These medications affect certain chemical signals in the brain and body. Some studies have explored whether long-term use of certain anticholinergic medications may be linked to memory and thinking problems in older adults. This does not mean that taking it occasionally will automatically harm your memory. The concern is usually related to long-term or frequent use, especially in older adults. That is why many healthcare professionals encourage seniors to review all medications regularly with their doctor. But here is something many people do not realize. The next medication is often prescribed for a completely different reason. Millions of older adults take it every day, yet very few know that researchers have also studied its possible effects on memory and cognitive health. Medication number 2, certain bladder medications. The next medication may surprise you because it is not used for sleep or allergies. Many seniors take medications for an overactive bladder. These medicines are often prescribed to help reduce sudden urges to urinate or frequent trips to the bathroom. One commonly discussed example is oxybutynin. Like the first medication we discussed, some bladder medications belong to the anticholinergic group. Because of this, researchers have spent years studying whether long-term use may be associated with memory and thinking problems in some older adults. This does not mean everyone who takes these medications will experience memory issues. Many people use them successfully under medical supervision. However, experts often encourage older adults to review these medications regularly with their healthcare provider, especially if they notice changes in memory or concentration. What makes this medication interesting is that many seniors never suspect it could even be part of the conversation. They focus on sleep medications and forget about the prescriptions they take every day. But wait until you hear about the next medication. Millions of people have taken it for years, and some older adults may even have it sitting in their medicine cabinet right now. Medication number 3, certain older antidepressants. Now let's move to another group of medications that researchers have studied closely. Certain older antidepressants, such as amitriptyline, have been used for many years. In some cases, doctors may prescribe them for depression, nerve discomfort, sleep problems, or other health conditions. The reason these medications attract attention is because some of them also have anticholinergic effects. As a result, researchers have explored whether long-term use in some older adults may be linked to memory-related concerns. Again, this does not mean these medications directly cause dementia. Many people benefit from them. The important thing is awareness. Knowing which medications may deserve a conversation with your healthcare provider can help you make informed decisions. Think about this for a moment. How many medications do you take each day? Do you know why each one was prescribed? Have you reviewed them recently with your doctor or pharmacist? Many seniors are surprised when they discover that a medication they have taken for years may have side effects they never knew about. And here is where things get even more interesting. The next medication group is one that many people use for anxiety, stress, or sleep. It is extremely common, yet researchers have spent years studying its possible effects on memory and cognitive health. And that is exactly what we will discuss next. Medication number 4, benzodiazepines, common anxiety and sleep medications. Now let's talk about a medication group that many seniors have heard of, and some may even be taking right now. Benzodiazepines are commonly prescribed for anxiety, panic attacks, and sleep problems. Examples include lorazepam, diazepam, and alprazolam. These medications can be helpful for certain people when used appropriately under medical supervision. However, researchers have spent years studying whether long-term use may be associated with memory problems or cognitive decline in some older adults. Because these medications can affect the brain, experts often recommend using them carefully, especially in seniors. One reason these medications receive attention is because some people report feeling forgetful, confused, or less alert while taking them. This does not happen to everyone, and it does not mean the medication is causing dementia, but it is one reason healthcare providers often review these medications regularly with older patients. Think about this for a moment. Have you ever met someone who felt groggy or mentally slow after taking a sleep or anxiety medication? Sometimes the effects can be more noticeable than people expect, but this next medication group may surprise you even more because most people do not think about memory when they hear its name. Medication number 5, certain older antipsychotic medications. These medications are sometimes prescribed for specific mental health conditions and other medical situations where doctors believe the benefits outweigh the risks. Because these medications affect brain activity, researchers have also studied their possible impact on thinking, memory, and overall cognitive function in older adults. Healthcare providers are often very careful when prescribing these medications to seniors and usually monitor patients closely. The important thing to remember is that every medication has benefits and risks. The goal is not to create fear. The goal is to understand what questions may be worth discussing with your doctor. Many seniors are surprised to learn that medications taken for very different reasons can sometimes have effects that reach far beyond the condition they were originally prescribed to treat. And the next medications on our list may be even more unexpected. One is often used for motion sickness, while another is commonly prescribed for muscle discomfort. Yet both have attracted attention from researchers studying memory and cognitive health in older adults. Medication number 6, scopolamine and other motion sickness medications. The next medication may surprise many people because it is often used for motion sickness. One example is scopolamine. These medications can be helpful for preventing nausea during travel, but researchers have also looked at their effects on memory and thinking because some have anticholinergic properties. In some older adults, these medications may cause confusion, drowsiness, or temporary memory-related side effects. This is one reason healthcare providers often use extra caution when recommending them to seniors. Medication number 7, certain muscle relaxants. Another group that researchers pay attention to includes certain muscle relaxants, such as cyclobenzaprine. These medications are sometimes used to help with muscle discomfort. The reason they are discussed in older adults is because they can sometimes cause drowsiness, confusion, or difficulty concentrating. While these effects do not mean dementia is developing, they can sometimes affect how clearly a person thinks or feels. Medication number 8 and number 9, certain anti-nausea medications and over-the-counter sleep aids. Some older anti-nausea medications, such as promethazine, have also been studied because of their anticholinergic effects. In addition, some over-the-counter nighttime sleep products contain diphenhydramine, the same ingredient we discussed earlier. Because these products are easy to purchase, many seniors use them regularly without realizing they may deserve a conversation with their healthcare provider. The most important lesson from today's video is simple: never stop a medication on your own. Many of these medications help people every day. However, if you are over 60, it may be a good idea to review your medication list with your doctor or pharmacist from time to time. They can help determine whether your current medications are still the best choice for your situation. This video is for educational purposes only. Please consult your healthcare provider for medical advice. Tell me in the comments, were you surprised by any medication on today's list? If you found this video helpful, please like the video and subscribe to the channel for more simple health information designed for older adults. Thank you for watching. Stay informed, stay active, and I'll see you in the next video.